Imagine
In
it's
healthy veins, tiny valves open
2:47
to let
in
blood
the
move
morning.
upward toward
The
the
house
heart
is completely
and close
silent.
to stop it from
The
falling
world
back.
outside your
When the
window
valve
is still
weakens,
asleep.
it can no longer
But inside
seal.
your bedroom,
This
something
spot in the
familiar
web
happens
between your
again.
thumb and
Your
index finger
eyes
is a
slowly
common pressure
open,
point used
not
to
because
ease
you want to
tension and
wake
support
up,
circulation.
but because your
Place
body
the
is
pad of your
forcing you
opposite
to.
index finger on
You
the
sigh
highest part of the
quietly,
muscle,
push
just
the
above.
blanket
Standing
aside,
on your
and
tiptoes
sit on
turns
the edge
on
of
the
the
calf
bed.
muscle pump.
Your
When the
feet
muscles
touch the
contract,
cold
they
floor.
squeeze the deep
Your
veins
joints
and push
feel
blood
stiff.
upward toward the heart.
Your eyes
The
are
blue
barely
arrows
open
here
as
show
you
that
shuffle
flow.
slowly toward the bathroom in the dark. Maybe this happens once a night, maybe twice. For some people, it's 3 or even 4 times before morning finally comes. And somewhere along the way, most people over the age of 60 start believing the same thing. This is just part of getting older. Maybe someone told you that your bladder is shrinking. Maybe you were told it's your prostate, or simply that aging bodies cannot sleep through the night anymore, so you accept it. You adjust your life around it. But what if that belief is completely wrong? What if waking up at 2 or 3 a.m. to urinate is not actually a bladder problem at all? What if the real cause has nothing to do with how much water you drink, and everything to do with what's happening in your muscles, your nerves, and even the fluid in your legs while you sleep? And what if a simple 10-minute routine before bed could help your body finally sleep through the night again? For decades, most people have been told a very simple explanation for waking up multiple times during the night to urinate. They are told that it is just a normal part of aging. The bladder gets smaller, the body changes, and nighttime bathroom trips are simply something older adults have to live with. But that explanation, while common, is often incomplete and sometimes completely wrong. In the vast majority of cases I see in my practice, the size of the bladder is not the real problem. The bladder itself is usually capable of holding a normal amount of urine. What changes is the pressure being placed on it and the signals your nervous system is sending to your brain. Think of your bladder like a water balloon sitting in the middle of your pelvis. Under normal circumstances, that balloon has space around it. It can slowly fill during the night without triggering any alarm signals. But when the muscles around the pelvis become tight and rigid, that space starts to shrink. Now imagine someone tightening a belt around that balloon. Suddenly, the same amount of liquid feels like too much. The pressure rises earlier than it should, and your brain receives a message that says, "You need to go to the bathroom right now," even when your bladder is only partially full. This is why so many people wake up, rush to the bathroom, and then feel confused when only a small amount of urine comes out. The body was not responding to volume, it was responding to pressure and nerve irritation. Years of sitting, driving, watching television, and moving less than we used to cause the muscles in the hips, pelvis, and lower back to become stiff. These tight muscles act almost like a corset wrapped around the bladder and pelvic organs. When that happens, the bladder starts sending false alarms throughout the night. And the most important thing to understand is this: a mechanical problem requires a mechanical solution. Over the years, I have spoken with hundreds of patients who believed they were simply destined to wake up several times every night for the rest of their lives. Many of them were in their 60s, 70s, or even 80s, and they had heard the same message from friends, family members, and sometimes even healthcare professionals. It's just age. But when we looked more closely at what was happening in their bodies, a very different picture often appeared. What I repeatedly found was not a failing bladder. Instead, I saw bodies that had slowly become less mobile over time, hips that had lost their natural range of motion, lower backs that had stiffened after years of sitting, pelvic muscles that had been quietly tightening day after day without anyone realizing it. When you spend large portions of your day sitting in a chair, in a car, or on a couch, the muscles around your pelvis begin to shorten. The hip flexors tighten, the inner thighs become rigid, the lower back compresses. Over time, this creates constant background tension throughout the pelvic region. Your pelvis was never designed to stay frozen in one position for hours at a time. It was designed to move, rotate, bend, and shift throughout the day. Movement keeps the muscles supple and the nerves calm, but when that movement disappears, the body compensates by creating stability through tightness. Unfortunately, that tightness does not stay isolated in one place. The pelvis is a central hub where muscles, nerves, blood vessels, and organs all share the same limited space. When the surrounding tissues stiffen, The bladder is often the first organ to feel the consequences. And this is where empathy becomes important, because many people begin to feel embarrassed or frustrated about their nighttime bathroom trips. They assume something must be seriously wrong with them. In reality, their body is often just asking for something it has been missing for years: gentle movement and release. So tonight, instead of talking about medications or complicated treatments, I want to show you something far simpler and far more practical. I want to walk you through a short routine that takes about 10 minutes before bed, and it is specifically designed to release the tension that builds up in the hips, pelvis, and lower back during the day. This routine focuses on 3 key systems in your body that most people never connect to nighttime urination. The first is your muscles. Tight muscles around the pelvis and hips can compress the bladder and create pressure that triggers early signals to urinate. When those muscles relax and lengthen, the bladder suddenly has the space it needs to function normally through the night. The second is your nervous system. Certain nerves that pass through the hips and pelvic floor help control the signals between your bladder and your brain. When those nerves become irritated by tight muscles or poor movement patterns, they can send false alarms that wake you up even when your bladder is not actually full. The third system is something that surprises almost everyone when they first hear about it: fluid circulation. During the day, gravity pulls fluid down into your legs and ankles. When you lie down at night, that fluid returns to your bloodstream and eventually reaches your bladder. For many people, that shift is exactly what triggers those 2 a.m. bathroom trips. In the next few minutes, I'm going to guide you through 5 simple movements that address all 3 of these issues: your muscles, your nerves, and the fluid dynamics in your body. And the final movement may be the most important one of all. Let's begin with the first movement, which targets one of the most overlooked areas connected to nighttime urination: the lower back and the deep hip flexor muscle known as the psoas. Lie comfortably on your back on your bed, a yoga mat, or even a carpeted floor. If your neck feels strained when lying flat, place a small pillow under your head so your body can fully relax. Your legs should be extended naturally in front of you. Now slowly bend your right knee and gently bring it toward your chest. Use both hands to hold your shin or the back of your thigh, whichever feels more comfortable. There is no need to pull aggressively. The goal here is not to force a stretch, but to allow your body to gradually release tension. While you hold this position, keep the opposite leg extended on the ground and allow your lower back to soften into the surface beneath you. You may begin to feel a gentle stretch through the front of the hip on the extended leg. That stretch is reaching the psoas muscle. The psoas is one of the deepest core muscles in your body. It connects your spine to your legs, but what many people do not realize is that it also shares connective tissue with organs inside your abdomen, including structures surrounding the kidneys and bladder. When you spend long hours sitting, the psoas slowly shortens and tightens. Over time, this tight muscle can subtly compress the space within your lower abdomen. When that space becomes restricted, the bladder has less room to expand comfortably as it fills overnight. By gently lengthening this muscle before bed, you give your bladder more physical space to function the way it was designed to. As you hold the position, begin focusing on your breathing. Take a slow breath in through your nose, allowing your belly to expand. Then exhale slowly through your mouth. Long, slow exhalations activate the vagus nerve, which helps calm your nervous system and signals the bladder muscle to relax rather than contract. Stay here for about 20 to 30 seconds, breathing slowly. Then gently release the leg and switch sides, bringing the other knee toward your chest and repeating the same process. After finishing the first movement, allow both of your feet to return to the surface beneath you with your knees bent comfortably. Take a moment to notice how your lower back and hips feel. Many people already begin to feel a small sense of release in the pelvis at this point. Now we are going to move into the second position, which focuses on the inner thighs and their connection to the pelvic floor. Slowly bring the soles of your feet together and allow your knees to gently fall outward to the sides. Your legs will naturally form a diamond shape. This position is often called the reclined butterfly. If your hips feel tight, or if there is any strain in your knees, place a pillow or folded blanket under each knee for support. Remember, this is not about forcing flexibility. The goal is to allow the muscles of the inner thighs to gradually relax. The muscles we are targeting here are called the adductors. These muscles run along the inside of your thighs and attach directly to the pubic bone, which is part of the pelvic ring. What makes them especially important is that they share a close relationship with the pelvic floor muscles. When the adductors are tight, they constantly pull on the front portion of the pelvis. That tension spreads into the pelvic floor like a ripple across water. The pelvic floor then remains in a subtle state of contraction throughout the day and often throughout the night as well. When the pelvic floor stays tense for too long, it can send confusing signals to the bladder. The brain begins to interpret that tension as urgency, even when the bladder itself is not completely full. This is one reason people often wake up during the night feeling a strong need to urinate, only to find that very little urine actually comes out. While you hold the butterfly position, place one or both hands gently on your lower abdomen. Take a slow breath in through your nose and imagine that breath traveling all the way down into your pelvis. As you inhale, allow your belly and pelvic area to expand slightly. Then exhale slowly and imagine the tension in your inner thighs melting downward toward the surface beneath you. This breathing pattern increases blood flow to the pelvic organs and helps shift your body from the alert fight or flight state into the calmer rest and digest state that is necessary for deep sleep. Stay in this position for about 30 seconds, allowing the hips, inner thighs, and pelvic floor to soften with each breath. From the butterfly position, slowly bring your knees back together and place both feet flat on the surface beneath you. Take a moment to reset your hips and allow your body to relax before moving into the next exercise. This third movement focuses on something many people never realize is connected to nighttime bathroom trips. The nerves that run through the hips and pelvic floor. Lift your right foot and place your right ankle gently across your left knee. Your legs will form a shape that resembles the number 4. This is often called a figure 4 position. Now place your right hand lightly on your right knee. Instead of pulling the leg toward your chest, simply apply gentle pressure to guide the knee slightly away from your body. The movement should be small and comfortable. As you hold this position, you may feel a stretch deep in the outer hip or buttock area. That sensation is coming from a muscle called the piriformis. The piriformis is a small muscle located deep in the hip, but it plays an important role in how the nerves of the lower body function. Running very close to this muscle are two important nerves, the sciatic nerve and the pudendal nerve. Most people have heard of the sciatic nerve because it is associated with lower back pain and leg discomfort. But the pudendal nerve is the one that matters most for bladder control. This nerve carries signals between the brain and the pelvic floor, helping regulate sensations related to urination. When the piriformis becomes tight, it can irritate or compress these nearby nerves. When that happens, the signals traveling along those nerves can become distorted. Your brain may receive a message that feels urgent, even if the bladder is only partially full. This is why some people wake up in the middle of the night convinced they urgently need the bathroom, only to discover that very little urine actually comes out. The bladder was not full. The nerves were simply sending confusing signals. While holding this figure 4 position, you can add a very small rocking motion. Gently sway your hips an inch or two from side to side. The movement should be slow and relaxed, almost like a gentle cradle. This subtle motion helps the nervous system settle down and encourages the muscles around the hip to release their grip. Stay here for about 20 to 30 seconds, breathing slowly. Then switch sides by placing the left ankle across the right knee and repeating the same gentle stretch. Remain lying on your back and bring both feet flat onto the surface beneath you, about hip width apart. Your knees should be comfortably bent and your arms resting by your sides. Take a moment here to relax your shoulders and jaw. Many people carry tension in these areas without realizing it, and that tension often travels down through the body. This next movement focuses on the relationship between your glute muscles and your pelvic floor. Before lifting your hips, we will start with a simple pelvic tilt. Imagine there is a small marble resting on your belly button. First, gently tilt your pelvis backward so the marble would roll toward your chest. As you do this, your lower back will flatten softly against the bed or floor. Then slowly tilt your pelvis forward so the marble would roll toward your feet. Your lower back will create a small natural arch again. Move back and forth between these two positions several times. This gentle motion helps restore movement to the lumbar spine and pelvis, areas that often become stiff after years of sitting. Many people describe this as waking up the lower back. Now on your next backward tilt, press your heels lightly into the surface beneath you and slowly lift your hips a few inches off the ground. This is called a bridge position. You do not need to lift very high. Even a small lift is enough. As your hips rise, gently squeeze your glute muscles. These are the large muscles in your buttocks that help stabilize the pelvis when you walk and stand. Over time, especially after retirement or years of reduced physical activity, the glutes often become weaker. When the glutes are not doing their job, the pelvic floor begins to compensate. It tightens and overworks in an attempt to stabilize the core. Unfortunately, a constantly tense pelvic floor can irritate the bladder and increase the sensation of urgency during the night. By activating the glutes with this small bridge movement, you allow the pelvic floor to finally relax and share the workload again. Hold the bridge for about 3 seconds while breathing slowly. Then lower your hips down one vertebra at a time until your back rests fully on the surface again. Repeat this gentle lift 5 or 6 times. The movement also acts like a small pump, encouraging blood flow and lymphatic circulation through the pelvic region before you go to sleep. Remain lying on your back after finishing the bridge exercise. Allow your hips to settle and your breathing to return to a calm rhythm. The final movement in this routine is the most important one, and it addresses a cause of nighttime urination that many people have never heard about. During the day, gravity is constantly pulling fluid downward into your legs and ankles. Even if you do not notice visible swelling, small amounts of fluid gradually accumulate in the tissues of your lower legs while you sit, stand, or walk. This is completely normal. Your body manages this fluid balance all the time. But the moment you lie down to sleep, gravity is no longer holding that fluid in your legs. Slowly, it begins to move back into your bloodstream. Once that fluid re-enters circulation, your kidneys immediately begin filtering it. Within an hour or two of falling asleep, that filtered fluid becomes urine. Your bladder fills, and suddenly you wake up at 2 or 3 in the morning needing to go to the bathroom. For many people, this process has nothing to do with how much water they drank before bed. It is simply physics and fluid movement inside the body. What we are going to do now is help your body process that fluid before you fall asleep. Slowly lift your legs so your feet are higher than your heart. You can place your legs against a wall, rest them on several pillows, or simply hold them elevated if that feels comfortable. The goal is to encourage the fluid in your legs to begin moving upward toward your core. Once your legs are elevated, begin pumping your ankles. Point your toes away from your body, then flex them back toward your face. Continue this motion rhythmically, almost like you are gently pressing a gas pedal. Your calf muscles act as a secondary pump for your circulation. Each time you flex and extend your ankles, those muscles squeeze the veins in your lower legs and help push fluid back toward your heart. Continue pumping your ankles for about 60 seconds. As that fluid returns to circulation, your kidneys will begin filtering it while you are still awake. You may feel the urge to use the bathroom once more before going to sleep, and that is exactly the goal. By clearing that fluid beforehand, your bladder is far less likely to wake you up in the middle of the night. Before we finish, there is one more small adjustment you can make that often has a surprisingly powerful effect on nighttime bathroom trips. It has nothing to do with exercises and everything to do with how and when you drink fluids during the day. Many people who struggle with waking up to urinate at night try to solve the problem by simply drinking less water. They stop drinking fluids in the evening, sometimes as early as dinner time, hoping that an empty bladder will help them sleep longer. But the body does not work quite that way. When you become even mildly dehydrated, your bladder lining can become more sensitive and easily irritated. Instead of calming the bladder, dehydration can actually make it more reactive. This means your bladder may signal urgency even when only a small amount of urine is present. A better approach is to shift when you drink your fluids rather than dramatically reducing them. Try to stay well hydrated earlier in the day. Drink most of your water during the morning and afternoon hours when your body is active and your kidneys are naturally processing fluids more efficiently. Then, about 2 hours before bedtime, begin tapering off your fluid intake. This does not mean you cannot take a small sip of water if you feel thirsty, but avoid large glasses of liquids late in the evening. By the time you perform the short movement routine we just practiced and prepare for sleep, your body will already be in a better balance. Your muscles are relaxed, circulation has improved, and your kidneys have had time to process most of the fluid from earlier in the day. These small adjustments work together to give your bladder the quiet nighttime environment it needs to stay calm until morning. If you have been waking up several times a night for years, it is very easy to start believing that something in your body is broken. Many people begin to feel frustrated with themselves. Some even feel embarrassed talking about it with others. But the truth is, in many cases, your body is not failing you. It is simply responding to patterns that have developed slowly over time. Years of sitting more than moving, tightening muscles that were meant to stay flexible, and allowing circulation to slow down in the lower body can gradually change how the bladder behaves during the night. None of this means your body has lost its ability to sleep deeply. It simply means certain systems in the body need a little help returning to balance. The encouraging news is that the body is remarkably adaptable. Muscles that have been tight for years can begin to release when they are gently moved again. Circulation improves when the body is encouraged to shift fluid more efficiently. Even the nervous system can learn to quiet down once the signals coming from the pelvis become calmer. Small, consistent habits often create the biggest changes. 10 minutes of gentle movement before bed may not seem like much, but over time, those minutes can gradually restore space, calm the nerves that influence the bladder, and allow your body to rediscover the deep, uninterrupted sleep it was designed for. Before you go to bed tonight, take a moment to remember the simple routine we just walked through together. First, gently bring one knee toward your chest to release tension in the lower back and the deep hip muscles that can compress the bladder. Then allow your knees to open into the butterfly position, letting the inner thighs and pelvic floor relax. Next, cross one ankle over the opposite knee in the figure 4 stretch to calm the nerves that travel through the hips and connect to the bladder. After that, use a few gentle pelvic tilts and small bridges to wake up the glute muscles and reduce the strain on your pelvic floor. And finally, elevate your legs and pump your ankles to help move fluid out of your lower legs before sleep, so your kidneys can process it while you are still awake. Altogether, this routine takes about 10 minutes. That's it. 10 quiet minutes to loosen the muscles around your pelvis, calm the nerves that influence your bladder, and allow your circulation to reset before the night begins. Try doing this routine every evening for the next 7 days. Give your body a little time to respond. These tissues did not become tight overnight, and they may take a few days to fully release. But many people notice changes sooner than they expect, because sometimes your body does not need medication, complicated treatments, or drastic changes. Sometimes it simply needs space, movement, and a chance to relax again. And when that happens, sleep has a way of finding you naturally.